The birth of a new baby is a miracle, but the miracle doesn't happen without help. At Halifax Health Center for Women and Infant Health, we are committed to making your birth experience the safest, most comfortable, and memorable miracle possible. This experience begins with our birthing classes conducted for 30 years by certified childbirth educator Jan Wagner.
I try to prepare them emotionally and physically by giving them information on anatomy and physiology of pregnancy. I teach them the signs of approaching labor, the classic signs of labor, the stages and the phases of labor and delivery, some of the different avenues that their labor could possibly take, such as cesarean sections, which is just another way to have a baby, and they also learn what happens to them after they give birth.
The class is not only about breathing during contractions. Expectant parents are prepared for pregnancy, labor, and delivery, and gain a full understanding of their choices.
I also do something fun for the daddies. On one of the class nights, I ask them to put their names in a bucket. And then I will draw one lucky contestant, and they get to wear the empathy belly that I have. And the empathy belly actually simulates a 9-month pregnancy. The day their baby is born will never be just another day in their life again. So why not be fully prepared emotionally and physically? And that certainly will help them have a more positive birth experience.
At Halifax Health, the preferences, comfort, and safety of our patients are the guiding principles. If a mother wants to deliver naturally, we have midwives who are experienced in all forms of vaginal delivery. We also have very experienced surgical teams for mothers who choose to have C-sections. But we let the mothers direct the care and do not espouse any particular birthing method.
One of the things we see are a lot of C-sections in this country. We talked before about over 1 million C-sections done, and I think that the more people see how they're actually done, the actual step-by-step procedures, then there's a lot that demystifies it a bit, makes it a little less scary. The bottom line, honestly, is we want a healthy mom and a healthy baby. The route of delivery, honestly, is irrelevant. We don't care if it's a vaginal delivery or a C-section. We just want that mom to go out with a healthy baby in her arms.
Once the baby is born, the Halifax Health obstetrical nurses are there to help new mothers adapt. There is even a full-time dedicated lactation consultant who will give moms as much time as they need before and after their baby is born.
We usually go over really what baby will be acting like in the first 2 days, because the way they act in the first 2 days is completely different than the way they act, come day 4, day 5. So we usually go over that, let her know what she'll experience is very normal, what the baby's going to be doing is very normal. We go over a few positioning techniques, and then when the baby's ready to eat, then if I'm in there for it or if I'm not in there for it, they can always call me back into the room. We usually definitely will try and get that first feeding together. So for me to be able to at least answer their questions over the first couple weeks, whether it be by phone or email, gives them a lot of security to keep them going.
Although most babies are born healthy, there are rare circumstances where extra care is needed. With the only 24-hour neonatal intensive care unit, or NICU, in Volusia County, Halifax Health is capable of caring for infants as premature as 26 weeks. The NICU handles the whole gamut of neonatal difficulties, from low birth weight to serious heart and lung problems, with the same care and compassion that is given to healthy babies.
Well, I think it's very important in choosing a place to deliver a baby to be at a place where the chances are that most likely, even if you run into some trouble perinatally, the mother-baby unit can maintain its intactness. And that what I'm saying by that is that even if the baby has a problem, the mom will be right down the hall in her OB bed and can come down for frequent visits. We encourage family visits and family involvement and teaching.
Halifax Health Center for Women and Infant Health has the resources and expertise to handle even the most complicated births with unparalleled safety and compassion.
I think Halifax Medical Center is the safest hospital in the area in which to have a baby. We are very fortunate to have a neonatal intensive care unit. I personally would never deliver in a hospital that did not have one. Our nurses have been here for many years. We have a fabulous staff of women who can take care of moms during labor and moms and babies following delivery.
Halifax Health Center for Women and Infant Health. Let us be a part of your miracle.